Good morning, Chicago, and thank you for tuning in. I'm Dr. Allison Arwady. I'm the Commissioner at the Chicago Department of Public Health, and we are here to give you an update on COVID-19 here in Chicago and take your live questions. As always, you can put your questions into the chat box below. You can send them on Facebook, Twitter with the hashtag AskDrArwady, and we will look forward to answering them. Today is Thursday, July 30. I have to just check my dates there a little bit. And happy to have you here. So as you can see, we have a guest. This is Damian Plaza, and he is a Chicago Department of Public Health employee who has been doing a lot of work with case investigation and contact tracing. So this is a topic that we get a lot of viewer questions about. And so thank you to Damian for coming on.
Thank you for having me. I'm excited about this.
Yeah.
Hopefully we can give out information that can help the public. So
exactly, great. So tell us just a little bit. You know, I know you've been with the city for a long time at this point, and you've done a few different things. Let folks know a little bit about, you know, your background and sort of how you got to where you are.
Okay, well, I started with the city in 2002 as a communicable disease investigator in STD, but now it's called STI.
Sexually transmitted infections.
Sexually transmitted infections, yes. And I was stationed out of Cook County Department of Corrections, the jail on 26th in California, and I was there for many, many years. So when the opportunity arose to come to communicable disease, that's what I did. So now I do specifically communicable disease, which could entail salmonella, shigella, rabies, any gamut of diseases that we do, and we do that very well, I think. So then now with the new COVID coming up, here I am, and I do have a background in social work. I graduated from Northeastern Illinois University, and I'm excited to be here with Dr. Arwady.
Yeah, absolutely. Yeah. Thanks. And so you mentioned salmonella, shigella, rabies. This is because prior to COVID, the health department, and specifically the communicable disease program in the Chicago Department of Public Health, handles case investigation and contact tracing for about 70 different diseases. And so salmonella and shigella are two of the foodborne outbreak diseases that, you know, you have the job of tracking down, you know, when we're seeing outbreaks in restaurants or in, you know, food from across the country, figuring out what that looks like.
And that's what we do. And I think we got a really strong team. We've had a strong team forever, and it's like, it's really good because the dynamic works very well. So it kind of like trickles into to contact tracing too for us. Since we've already been doing this for many years, it became second nature to us.
Exactly. Yeah. So we'll come back and talk a little bit more detail about what this work looks like for COVID, because nobody really paid any attention to case investigation or contact tracing prior to COVID, and now everybody wants to know about it. So we'll come back in a minute. I forgot to show our 6-foot distance. Let's demonstrate that again. Just a reminder that this is really a good way when you are out and about to be keeping that 6-foot distance. Obviously, we also want people wearing masks, washing their hands, protecting folks who are at high risk, so nothing different there. So let's take a look for a few minutes at where we are with data. As a reminder, you can go to chi.gov/COVID-, that's for COVID dashboard, to get directly to our data dashboard. And here we are. Have we got it up? All right. So if we take a look, our confirmed case number here is up to an average of 255 cases per day. And that has continued to slowly increase. If you've been following along with us closely, we really would like to have this number back under 200 if we could get there. When we're over 200, we're kind of in a zone where we're thinking about, you know, what is driving this outbreak. We've talked about we continue to see increases in people who are younger. And it's a space where definitely we have some concern. If we get that number up to about 400 cases per day, that would be at a state where we would probably need to make some even more significant rollbacks. So keeping an eye on that. You can see that we're still at just 3 deaths per day. That number has come down really nicely. And in fact, if we flip over to deaths here, today's the 30th, and I'm just showing you how you can do this. You can zoom in on here, I zoomed in here for the last month and a half, you can see that this date here from July 23rd actually has no deaths reported, and we're giving it at least a week because sometimes we'll get delayed reports from the medical examiner. But if we get through today without reports, that actually would be our first day with no COVID deaths in Chicago going all the way back to March. But overall, the death data, the hospitalization data all does continue to look good. But our cases are slowly on the increase, and that positivity rate is also on the increase. So we're at 5.9% today with the way that we've been calculating it using the cases, when we divide by the individual cases divided by people tested as opposed to the total number of tests. We are going to have an update to this dashboard actually later this evening, where we will also include the percent positivity with the way that the state is calculating it, which uses total tests as a denominator. And with that, we're at about a 4.8, 4.9% positivity, just because we get a lot of questions about it. I think other than that, if we take a quick look at age here, again, I have this just limited to the last month and a half right now. You can see that in red here are the 18 to 29-year-olds, still really our highest group in terms of cases. And you can see we're coming back down there a little bit in July, starting to see that trend back up, followed by in blue and yellow, the 30 to 39, the 40 to 49-year-olds. So really, we're doing extra work with young folks, but really want people to hear that even folks in that younger group, we're seeing a lot of COVID and unfortunately a lot of spread. You can also, just as a reminder, click on the weekly zip code here, and this is where we update every week. So this would be for data ending the week of July 25th. It will get updated each day, and so you'll see a little bit of change here. But you can see, for example, that we had about a 10% increase in cases from the prior week, and we had more than a 1% increase in positivity. So neither of those are the direction that we want to see. Nothing is major alarm here, but I don't like seeing the directions of trending up, and we're keeping a close eye on it. So I think with that, we'll turn away from data. I encourage you to keep taking, there's all kinds of things to explore on there. But let's come back and talk, Damien. So, when you're hearing sort of about some of these numbers, tell me about, what is your day-to-day work like, and how do you connect some of what we're hearing, where we're seeing these increases, with some of the work of case investigation and contact tracing?
Well, I think with the case investigations, we are getting more and more younger people.
Yep.
Especially like when we call the household and somebody says, "Well, my son hangs out with his friends."
Yes.
Who go out to other places together. That's alarming, because I don't think that age range is really understanding the severity of what COVID is. Mm-hmm. And I think we need to get more into their heads to let them know that, no, this is no joke.
Right.
So I think, I'm seeing the trend with more younger people.
Right.
And when we speak to adults, they're telling us about their teens, about, well, they go out with their friends. They're not social distancing, as we can see in media also. Right. So I think we need to figure out a way to combat that. Yeah.
So talk people through, if you will, really in a fair bit of detail, what does some of your work look like day to day? How do you find out about a case? What is your role? What is that conversation like? Like, really go ahead and talk with folks about, this is hard work and you do it every day.
Well, first of all, let's talk about what contact tracing is. Basically, it's a process of identifying, assessing, and managing people who have been in contact with somebody who has a disease, and to prevent the onward transmission. Contact tracing for us is a critical step in controlling transmission, especially as cases begin to go lower and the public seems to be opening up more. We need to take that into consideration. So I think that we need to have that understanding of what COVID is and what it actually does. When we do call somebody, say in a household, a lot of times they're afraid to talk to us. Mm-hmm. We're finding that a lot of Spanish speaking only have a tendency of not believing who we are. Mm-hmm. So we have to break that barrier, which we do pretty well.
And you speak Spanish?
Absolutely. But the good thing about the city of Chicago, we also have a language line. So for those contact tracers who don't speak Spanish or any other language, we have a a language line that allows us to speak any language. So basically we call it in, we tell them what language we want to speak to the person, and then they are the third party, so it works either way. So we're contacting more than just English speaking, but I think we need to still break the barriers with the ages also. So yeah.
Yeah. So you were saying, so sometimes, especially maybe with people who only speak Spanish, they're not believing who you are. What do you? How do you address that?
Well, in the beginning, we've been doing contact tracing from the very start of COVID. When it was brand new to all of us, we're like, oh my God, what do we do? But we broke through it. In the beginning, we were speaking to Latinos, older also, and some of them did stress out that they didn't believe that we were who we were because it's brand new.
Yeah.
One person actually said, do you guys work with ICE?
Yeah.
Do you guys work with immigration? So we had to break that barrier and let them know, no, that has nothing to do with that. What we're trying to do is we're trying to prevent disease. So they would ask, well, how do we know you're who you are? Well, call me back in the office, call my supervisor. Whatever you have to do, we have to maintain that person's trust. So once we get it, that's our way in to get more information from them.
Yeah, and it's important, and I know you help share this information, but when we're doing this level of case investigation and contact tracing, we don't share the personal detail of it. It does not go to the federal government. It does not sort of move out beyond the public health investigation, and there's a lot of privacy and data security, both laws and then sort of practical considerations there.
And in the city, of course, we do that, have a HIPAA guidance that we can't share that information, and we let the person know, or the people that we're speaking to, this is absolutely private. This information is only used for us in the medical field or in the health field. Their worry is, well, is my job going to find out? Well, no, we're not going to give that information because we are sticking to laws. So we let them know that it's very private, and those names and dates of birth, because a lot of times people don't want to give their kids dates of births also. We let them know this is very private, and this goes no further than with the Department of Health, because we're trying to combat the disease.
Yeah. So let's talk about that work piece. When someone says, I don't want my work to know, but perhaps they've had some exposures at work. Like, talk through a little bit of what that looks like, because people may not understand that very well.
Okay. When somebody says that they've had exposures to work, well, we go to a different level. We have a system too that with congregate settings and with work settings where we actually know when certain work or jobs have had extra cases of COVID. Of course, we don't let them know the names of the people who gave it. That's right. But that's an important piece, because then we start piecing together, oh wow, we have a lot more people in this facility or in this corporation that have COVID. So that's another thing that we have to work on. So we have a good team when it comes to those settings also.
Yeah, absolutely. And I think this is one of the things that is just a little strange, that people don't understand if they're not used to this. But if I am doing contact tracing, so first of all, you have, first you start with the case. You have the list of, someone who has been diagnosed with COVID, and you're reaching out and having that initial conversation with them and identifying anybody who's been in close contact with them. But then with the contact tracing, like say, your case says, Joe Smith was a contact of mine. When we call Joe Smith, we don't give the name, actually, of the person who had COVID. We say instead, we have reason to believe, you may have been exposed to COVID, and here's what we need you to do. But we actually protect the identity, and that's true for all of the communicable diseases, not just COVID. But I think, it's people don't realize that, I think.
Yeah, no. Well, as contact tracers, we have to communicate information to this person who's given us the information. We do notify them of exposure, of course. We provide disease and transmission information. We gather data of demographics of the person and of the people that they believe they were in contact with. And we assess signs and symptoms, and at times we have to, to evaluate if they should be tested, which some of them don't know that they have it.
Right.
We do get cases where we have it way before they find out. So we have to be very sensitive with that and let them know, you did test positive for COVID. This is when they get nervous and they say, well, am I going to die? Well, no. That's why we go through the whole process of what COVID is. And if they do have underlying conditions or immunocompromised, of course, we have to monitor a little bit more. So we do keep in touch with some of the people that we do speak to. So yeah, just to make them feel at ease. And in the beginning also, we have social workers who were working with these people.
Yep.
If they needed providers, we connected them with that provider too. But I think it's important that they know that we're here for them. We're not here to chastise them in any way. We're here to help them out with the disease and to make sure that they're okay in the end.
Exactly. And then there's also often a lot of work that can come where we're identifying needs for folks. So people may need to get connected to all different sorts of support. And so, I mean, some of that social work training, I'm sure, comes in really handy as you're thinking about how to support people. It's really stressful.
Yeah, and I tell my coworkers, all of us have different backgrounds. Some of us has different degrees. I said, we're all social workers now, so get ready. You just don't have the degree for this. But yeah, so we do connect people with the resources they need. And thankfully, the city of Chicago has compiled a good resource guide that is given to the tracers, and that really works. And some of us do have some resources that we share with each other. So it's really important that that is in play, because when people have to quarantine for 2 weeks, how are they going to get food to their house?
Right.
Who are they going to speak to if they're sick?
Right.
You know, things like that. So we need to make sure that the resources are available at all costs.
Yeah, absolutely. So what are some of the other questions that you ask when you're speaking to individuals? Are there questions that people are surprised by, or the questions that people sometimes don't want to answer?
Well, like I said, and especially like I said, if somebody is here illegally, they don't want to answer questions about their husband. They don't want to give a birthday for their husband or their wife. Yeah. But we try to ease their worries a little bit more. Some of the questions can be, am I going to die? Some of the questions are going to be, well, what about my kids? I have a baby. So those are questions that we have to overcome also and to answer for them also. Yeah. Yeah,
absolutely. All right, good. So we're starting to get lots of questions in. So we'll start taking some questions, and you can answer some and I can answer some, and we'll sort of do it together. So good. Here's a question from Andrea Arahu Ayala from Facebook. This is a data question. Why is it that when I check the dashboard in the same day, it might show 140 cases, and then a couple hours later, it might show 155 and 154 in the prior day? Why does it change numbers in the same day and the prior number doesn't match? I love that you are looking at the dashboard that much. Yeah, let me explain that. So every single day, we don't just update the cases that came in that day. We update the entire data set of hundreds of thousands of pieces of data that drive that data set. We update it once a day. It actually happens on the public dashboard around like 8:30, 9 p.m., 9:30, somewhere in that range. And so what will happen is if, for example, it showed you were at 140 cases, and then you look at it and it says you're at 155 and the prior day was 154, and you say, you know, why is that different? It's because if we get a lot of delayed reporting in, it turns out that the day before was maybe not at 140, it was at 155, but delayed reporting of cases meant that the day was higher. So this was also bothering me because I thought that it was potentially confusing to people, and so we're actually changing. I mentioned that we're going to have some updates to the dashboard. We're going to change it so that the comparison will actually be to where were we 1 week ago, because I think that is a better comparison. You'll still be able to look for people who are interested down in the specific data or on that graph down on the bottom right, but that kind of high level number at the top will say where are we today versus where were we, you know, if today is Thursday compared to last Thursday, because by that point we've pretty much had all the data in and you don't have this issue. So good question. This is one of the things where you're making data available just as quickly as it comes in that can make it look different. All right. Let's take another data question. Melanie Austin from Facebook. Does trending up mean we are approaching herd immunity that you say that we need? Do you want to chime in anything on that?
Go ahead,
you want me to take that one? All right. So herd immunity is generally the idea that enough people in a population have immunity to a disease that you're not going to then see very widespread disease through that population. So for something like measles, we have herd immunity because we have very good vaccination rates for COVID. And so even if you have the occasional person who may not have been vaccinated, you're unlikely to see a major measles spread because we have herd immunity. COVID, we are a very, 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 very long way from herd immunity. And this is true even in some of the hardest hit areas of the country and the world. Generally, there's some debates about what exact percentage do you need for immunity, but for herd immunity, it's really up in sort of the 70-ish% range at least. You'd like it to be even more like 80%. And so, yes, numbers are trending up, but still, let's go back to, I'm going to go back to the dashboard and give you the exact number here. If we go over to our weekly here, we are at about 59,000 cases in Chicago. That's 1 in 47 people have had COVID. And where we think about where we would need to be for herd immunity, it's like 7 in 10. You know what I mean? Like it's a very, very, very long way from this. So we'd need to get up to a point where it's actually more than 1 in 2. Right?
Yeah, we're still a ways away.
We're a very long ways away. And even in New York, that was very hard hit, in Italy and Spain, where they've gone and done these antibody tests, the highest that they've been finding is like 10%, 15%. We are not likely, honestly, to get anywhere near herd immunity before we have a vaccine. And then even once there's a vaccine available, we're only going to be getting toward that herd immunity part once we've actually managed to vaccinate, the majority of the population. So I like this question because sometimes people say, wouldn't it be better if I just got COVID and got it over with and sort of helped with it? What, do you hear that sometimes?
I've heard some.
Yeah, that is not helpful.
Not what you want to do.
Not helpful.
No.
It just spreads disease further. We want to really get to herd immunity through the vaccine. We don't want to drive it through natural infection. That's not been proven, first of all, to get us to herd immunity, and it puts people at risk of people who have the serious outcomes. I don't want people hospitalized. I don't want people dying. We just crossed 150,000 deaths in the U.S.
That's high.
So, yeah, good question. All right. Okay, here's a question for you. Juan Rangel on Facebook is wondering about, he's saying, is there any specific, he's asking about hiring contact tracers, but I'm going to take it a little broader. Any specific work experience or background that do you think is helpful for people who would be good contact tracers or would do that kind of work?
Well, believe it or not, I think one of them is personality. How do you approach a person?
Yeah.
I think in order to be a good contact tracer, you have to be able to meld into the person, meaning that you have to get to their level, speak to them the way they want to be spoken to, not like all this information, but more at a smaller level. As far as background, well, I've been an investigator for almost 30 years, but also some of us have had training through Johns Hopkins. We've had to go through a rigorous training. But I think it's just your personality and just showing compassion for people. I think that's one of the biggest things in order to be a good contact tracer.
Yeah, I would add on to that. I think the people who are really good at this are good at helping put people at ease on the phone. That is not actually an easy skill, and it's not necessarily something that you can get a degree in.
It takes a while.
It takes a while. I mean, there's definitely training, and that's important, and obviously. But fundamentally, I think people who are able to quickly try to establish some rapport, right? And that's.
And definitely not be non-judgmental.
Right.
Because a lot of times, they say something that may not coincide to what your beliefs are or whatever, but you got to take that out of the equation. You have to just be compassionate and you have to be able to listen. Sometimes people just want to talk, and by them talking and you just listen, you're getting more information without having to ask it.
Yeah, absolutely. Yeah, a lot of, especially when we're trying to do investigations, like for example, for the restaurant outbreaks, things like that, you really want people to talk a fair bit because sometimes you'll learn things that help you kind of crack the case a little bit, even more than from the questions.
Absolutely.
So yeah, I think people who are compassionate, people who are curious, and people who are just sort of good on the phone. that's really the main thing. So.
And you really don't need a degree for this.
Yeah.
Like we were saying, it's just something that, you have to be passionate.
Yeah. And that's actually a good segue. I'll just remind people that one of the really exciting things that we're doing here in Chicago is we're going to be adding additional contact tracers that are going to be community-based. So someone, Damien is like one of our most experienced case investigators, contact tracers, has all kinds of experience in doing this, but also, you've been part of a lot of these sort of more complicated investigations where we're needing to understand what's happening with spread in a workplace or a long-term care facility or a hospital. And so the health department obviously will stay involved in this, but we're going to be adding hundreds of folks.
And that's awesome.
Yeah. So maybe talk just a little bit. What are some of your thoughts on that? Like where we'll be bringing people on?
I'm excited about that because I think the community needs to be more involved.
Yeah.
A lot of community people want to be part of this.
Yeah.
Community organizations, they've even emailed that they want to be part of this. How do they do it? So I think it's really exciting that people in the communities that we're targeting or that are being targeted are part of it, because it takes a village to raise a child, more or less, so I think that's really important for us to do. So I'm excited about that point.
Yeah, absolutely. And just as a quick update there, so we've talked a little bit about this on here, but the lead organization that we're working with for this community-based contact tracing is the Chicago Cook Workforce Partnership, and they've actually just put out what's called a request for proposals for community-based organizations. So for community-based organizations that are in the areas of Chicago where we'll be doing this work and hiring folks from, I encourage you to go to chitracing.org. You can also always get there from chicago.gov/coronavirus right up at the top. But there's information on there if you're a community-based organization. You can get some technical assistance to really be able to apply for this. You can actually find the details of how you can apply, and then also on that same website, there is the ability for individuals to be able to put in their information if they want to potentially be hired themselves as a contact tracer. So August 18 is when the deadline is for these organizations to be able to apply, and then there will be a selection process. So we're taking our time a little bit in terms of building this up. We continue to do all of the contact tracing. I want to be very clear about that. Every case in Chicago, no matter where the person lives, we are initiating an investigation within 24 hours of receiving that report. And that's really important. It's a key metric, and we're hitting it. But we're going to be adding to our ability to do this. We're going to be bringing these new folks on. There's going to be training. And then these folks will be able to, to your point, be from community, helping to engage, also around the resource coordination and piece. It's going to be it's different than most other cities are doing. And,
it is. I really encourage you, if you know organizations, whatever size they are, get in touch with them and let them know that we're about to start this process, because I'm sure a lot of people are going to want to be part of it, but as community people, you have to read this also. So get on the website and just see it for yourself.
Yeah,
for sure.
Yeah, great. All right. Let's see. We got all kinds of good things coming on. I love this question. Aaron Alexa on Twitter. Do members of the Chicago Cubs and White Sox tests count toward our daily city counts? Could their large number of repetitive negatives be making our stats look slightly better? I love this question. So, if members of the Cubs or the White Sox live in the city of Chicago and are city of Chicago residents, their data would be included in our reported tests. And that is true for anybody who lives in the city of Chicago. If they live in suburban Cook, or they live in Evanston, or wherever else they may live, their numbers would then be counted in that jurisdictions, right? But the larger point here is that, are there places where we're getting repetitive negatives? So this actually gets into this conversation about how we define percent positivity. So if you include, because it's not just the Cubs and the White Sox, because that's a relatively small number of people, but you think about people who are getting repetitive testing, who work in nursing homes, for example, or who are caring for patients, in ICUs and emergency departments with COVID. Like people who are high risk are often getting repeat testing to help control the spread of COVID. And one of the main differences in how we define this percent positivity is whether we count them over and over again or we don't. So in the main way that the city has been putting forward percent positivity, we divide number of cases by number of individuals tested. So a Chicago Cubs or White Sox who is tested 10 times counts once. And that's across it's not just on one day, it's across quite a long time period. And so one of the reasons why at the state level, they actually include all of the tests that are done. And so the percent positivity here in Chicago is quite a bit lower for that. Our percent positivity, if you look at the way the state is counting it, is under 5%. It's like 4.8, 4.9%. It is not that one of these is right or wrong. It's just two different ways of counting. And so we're going to be adding actually the state way of counting this to the website. But right now, large numbers of repetitive negatives from Cubs, White Sox, or anybody else getting tests they don't do anything to the case count, because the case count is the number of positive tests. It's why I keep us primarily focused on the positive, the new cases we're adding every day. I think that's if I was following one number, it's the main one I follow. And then the percent positivity is kind of the secondary piece. And behind the scenes, we're asking exactly these kinds of questions and doing different calculations to understand it. So very nice question.
Great question.
All right. Okay, here's one for you. How could people spot a potential scam versus an actual contact tracer?
That's interesting. Well, that's a good question. I never thought about that. But as far as us, when we call somebody and they're leery about who we are, we have them call us back at the office or on our cell phone.
Yeah.
So I'm not sure how to answer that one as far as scammers.
Yeah, well, I mean, that's probably the number one, that if you're getting called and you have a concern, always, there's a number and you call back and you know that it's the health department. Also, though, we're working on this because right now, it often, like if you're called, how does the number show up on their phone? Do you know?
Well, if it's from our office, sometimes it does say City of Chicago, which I like that.
Right.
I wish cell phones would do that too, but they don't always show City of Chicago.
Exactly. So this has been one of the issues, that when people are in the office and calling, it's more clear that it's coming from the city. But just like everybody else, we have a lot of people who are working remotely, and particularly this kind of work that can be done largely by phone. We've got a lot of people using cell phones, and so that has been an issue. So we're building behind the scenes, we're doing a lot of work on tech. We're doing a lot of work to really build out our platforms, especially as we think about bringing in our community-based contact tracers, making sure that all the data is secure and in one setting, and really within my hope is just a week or two, we actually will have all contact tracing be coming from a single number.
That's awesome.
And then we'll start sort of publicizing that like if you get a call from this number, put it in your phone or know what it is. It's someone to help you from the health department. It's nothing related to that. So.
And I've also had on the weekend when I'm doing contact tracing at home, I've had people call me up on Monday in my office and I call them back. So it kind of works out that way.
Yeah.
You have to be very savvy how you do it, because you want to make sure you're getting the information from the person, but you don't want to lose them. If you can get the information up front, perfect. But if they don't trust that, I have them call me up at the office.
Yeah, absolutely. We've also been working on things like the ability to text, because we know younger people especially often, don't pick up the phone, to be honest. We have a big problem with that. We have people, you want to talk about that a little bit?
With especially young people. We wish that we could do texting years ago. We just got the call that we're about to go into that group where we're going to be able to text. Of course, when you text and you still have issues, but you want to make sure that you give what you need so that they can call you back. Young people, that's all they do. They do social media. They do texting. very unlikely call you on the phone. So the texting portion of it is really going to be important for us, and I think it's going to help our numbers to go lower also when it's contact tracing.
Yeah, exactly. Definitely. Because we reach out to every single case and every single contact that we get. But if people never engage, if they don't pick up the phone or they hang up, or we're not, we have a lot of we try multiple times at different times of the day, we send letters, we have processes, but there are people that we just never engage with. And so, some of this work to try to think about different modalities, make it easier for people to give the information, make them understand how their data is being protected is, I think, really important.
Absolutely. And the texting is very innovative for us because we haven't done that in the city. So this is going to be something exciting for us too.
Exactly. Yeah. Great. Okay, here's a question. Erica Allison from Facebook. What will the city be doing in light of the governor's sports guidelines? Yeah. I have a Park District swimmer desperate to get back, and swimming has been labeled a low-risk sport. Okay, thanks for the question, Erica. So there was some new information out yesterday at the state level about sports. So maybe we'll just take a minute and talk through that, and then we'll address the swimming question. So first, the High School Sports Association basically announced that in Illinois, most contact sports will not be playing this fall. So football, for example, is not happening this fall at the high school level. They're hoping to be able to do it in the spring. That is really dependent, I think, on what our outbreak looks at this point. But they've moved most of the sports to sort of say, we'll reconsider it in the spring. Some of the sports that are lower risk, like swimming, cross country, et cetera, are continuing at that high school level. In addition, they put out guidance for recreational sports. So besides just kind of in high school, everybody who's playing on, the soccer team or the basketball or the baseball, either a private group or any kind of other recreational type league. And for that, we'll make sure that there's a link to it on the chicago.gov/coronavirus page. But broadly, what happened is they broke the sports into 3 different risk levels. And you can see some more details online. But basically, they defined as higher risk sports like boxing and football and hockey and wrestling, sports that have just a lot of physical contact. They said those are in the high risk. And then they set medium risk sports, which included basketball, racquetball, soccer, volleyball, water polo. There's a list. Those were considered sort of medium risk in terms of contact. And then sports that were lower risk. And that includes things like baseball and bowling and climbing and golf and tennis, softball, swimming, diving, track and field, weightlifting. So those were considered lower risk. And what they said was that based on what our outbreak is looking like right now, for sports in that highest risk category, the football, rugby, et cetera, only thing allowed right now are no contact practices and trainings. So even in practices and training, they've got to be no contact. For the level 2, those medium risk, that would be like the basketball and the soccer, they are allowed to have intra-team scrimmages. So you can get together, you can practice, you can have sort of a fun game, like within your team, people are keeping skills up. But actually no competitive play is being allowed right now, even for those interim sports. For the lowest risk sports, which would include the swimming, back to this question here, they are allowed to have competition just within sort of your conference or your region. So for example, Chicago teams could play each other, but not really allowing big, extensive out-of-state travel, et cetera. So I refer you, to the guidelines here to get some more information. But basically, that's where we are. And some of this, again, is about who is most likely to be playing some of these sports. And it is our younger, 20-something, 30-something-year-olds in some of these recreational leagues. And then, of course, the youth. And so it's about, again, risk and stratifying it and sort of where are we on things.
And I encourage you guys to look at the references because they do change. They're not always in stone, so it can change from one week to another. So just keep up with it.
Yeah. exactly. So, some details to come certainly related to a given program, but these lower risk sports are the ones that, with all of the precautions in place, and, even around swimming, for example, they highlight here that it's restricted to single lane and singles diving and no relays or synchronized swimming or paired diving, right? I mean, there's a lot of detail in terms of what some of this means, but I refer you to the website for a little more detail, but this again is sort of an evolving space. All right, we are coming up on time. Maybe we'll just finish. We do have some more questions. Maybe we'll finish with just how has your life changed due to COVID?
Oh, it has really, really changed it, and unfortunately, we have to adapt.
Yeah.
I don't know if it'll last forever. Who knows? Nobody knows that. But it has changed. My elderly mom lives with me, who's, she has health issues also. So when all this happened, it was really hard because we couldn't even hug anymore because we weren't understanding it. It was too new. Even though now we know what we know, it's changed even in our workplaces. We're wearing masks. We're social distancing.
We don't because we're talking to you and keeping our distance, but in the office,
normally
we're wearing
it's
the masks.
And even some of my coworkers wear shields, which of course that's fine. But it has changed. The whole paradigm of what COVID did has changed. So we have to get on board and really try to combat it as best as we can. Get informed. That's the biggest thing I could say, because I've even spoke to some relatives who were misinformed. So inform people. Get on our website. We have the most updated information also. Wash your hands, but social distance is a big thing. It has changed it so much, and I want it to go back to normal. But what is normal?
Yeah.
We
New
just have
normal.
to adapt. New normal.
That's what we talk about.
Yeah, absolutely.
Yeah, exactly.
Absolutely. But I am very optimistic that we'll get through this somehow. It's going to take a while, but we cannot do it. We all have to do it. Anybody who's looking on Facebook, Twitter, whatever, we all have to do it as a team. We're not in this as a City of Chicago employee. We're in it as residents of the City of Chicago. So we need you all to do what you have to do.
Yeah, absolutely. I love that. Let's give a little bit of sort of good news and things to look ahead here. So one really, speaking of new normal, it's Lollapalooza weekend, and normally we would have 100,000 people in Grant Park. Clearly that's not happening. But starting today at 5 p.m., 5 p.m. to 1 a.m., Thursday through Sunday, totally free at youtube.com/Lollapalooza. They are doing hour by hour, all kinds of really cool music stuff. They're playing some archival footage from past Lollapaloozas. You can get up close and personal, including some stuff that's never been released before. They have mixed in there live acts. They have some local things. Like I was reading an article, and they've been putting a ton of work and effort into this. Totally free, and where there are, they've linked up with some charities that are sort of supporting COVID response as part of this. But really encourage you can go to lollapalooza.com to see the hour-by-hour schedule and the bands that are going to be playing, and it's all just streaming on YouTube. So starting today through Sunday, new normal. It's not the same as what we have, but an opportunity to see some really cool stuff. So
yeah, that's awesome. I think you guys should all check it out.
Yeah, absolutely. And I think the other just maybe thing to do is just a reminder for the census again. So Chicago, only about 55%, just over half of Chicagoans have responded to the 2020 census. Not where we need to be. The national average is at 62%, so we're not even hitting the national average. And this is how the city gets counted. Yeah. This is how we get representation. This is how we get funding. So if you want a healthy Chicago, if you want us to have the money that we deserve based on our population to bring services and have this be a strong city, we have to count everybody. So you can go to census2020.chicago.gov. Also on Twitter and Instagram @ChiCounts2020. You can follow right along, lots of things there. But it takes 5 minutes. one of the most important things that you can do, to participate and to really make us be as strong a city as we can be.
Absolutely. We need you guys.
Yeah.
Even you young folks, come on, get on there and help your parents out, your grandparents out. Do it. If you're in the same household, do it. I encourage it.
Yeah, absolutely. Thanks. So I think with that, again, this is Damian Plaza. He's one of our longest standing, strongest, most experienced folks in the whole world. One of them.
Many of us.
We have a lot of very experienced case investigators and contact tracers. Let me take a quick detour there, because you all see my face a lot, right? Like, I'm on here every day. I'm out with the mayor. I'm sort of in some ways one of the main faces that you'll see related to the Chicago Department of Public Health and the city of Chicago's COVID response. But there are hundreds of people at the Chicago Department of Public Health, like Damian, who are working like crazy, who have just, everybody has been working so hard, going back 6 months now to really get us to the progress that we've made. And so, I'm always thinking about all the people who are doing all that hard work, and know that when you see me, it's just one person in the realm of like so many people.
We have a plethora of investigators and workers who work so hard and tirelessly, who've been here for 30, even 40 years.
Yeah.
And their contribution is amazing. So I respect that all. And we have a bunch of warriors out there. Yeah. A lot of us.
And we will be hiring to that point. So we've gotten some additional COVID funding from the federal government. A lot of these jobs will be probably just sort of 2-year type of jobs, but we're hoping that if public health funding picks up broadly like it should, some of these may be able to extend into jobs that would go beyond the 2 years. So please keep your eyes peeled. And if you're interested, in addition to the community-based contact tracing work, the Chicago Department of Public Health is going to be hiring hopefully hundreds of people, over these next sort of 6 months or so. And so if you, even if you didn't know about public health before, but you've gotten interested because of this, please keep your eyes peeled for jobs with us too. So,
please do.
All right, we will be back for the longer conversation next Tuesday at 11 a.m. In the meantime, I am answering questions, and we're posting individual questions really every day, so you can keep sending those in. We keep track of them. We try to keep them answered. Thanks again for watching, and thanks for joining me.
Thank you for having me.
Yeah.
In Chicago, stay safe.
Be safe, Chicago.
Yes.
Bye, everybody.